Hi, my name is Mick Rogers from Axial Benefits, and today we're going to continue the series that we started about 10 weeks ago. You know, during the early days of the quarantine, we heard from so many of you with your questions, your thoughts, even some of the anxieties. So we thought that we'd put together, a video series of, a hand-selected small group of experts that could answer a lot of the questions that we got in their specific field, and we'd put it on a video format so that it would be easy to sort of understand and easy to watch. Today, I'm really excited about my next guest, Jeff Greenberg. Jeff is one of the founders of a company by the name of FireFly Health. But what I'm really excited about is because, just in the fact that we're talking to Jeff about his COVID reentry support program signals to me that we see the end, of coming out of this quarantine, right? That this pandemic is somehow going to be controllable and we'll be able to move forward. So the question that we have, as business leaders is we're all trying to think about how are we going to transition our employees now who have become comfortable working, on a remote or home location back into the office environment in a safe way. So welcome, Jeff.
Thanks for having me. Excited to be here, Mick.
Great. So, Jeff, in the early days of the quarantine, we had to interview, attorneys, and they had to go through the difference between a furlough and a layoff. And then there was HR consultants about, communicating to your remote staffs and the issues that may come up, of communication that way. Then we talked to a lot of benefit experts about, protecting their benefit programs, even 401k experts to talk about the impact of the CARES Act and what that might have on the fiduciaries. And now that we've become experts in all things, remote, we have to sort of switch gears now, and we have to forget about all that and really think about how are we going to, in a safe, carefully thought, professional manner, how are we going to get these employees back to our work environment and make them feel comfortable? And I know that FireFly Health has developed an employer program that I think is the most innovative thing that I've heard out there right now in this type of back to work support program. And while I want to dig deeper into that in a minute, I know that that's not your core business. So can we start with can you give us a brief overview of what FireFly Health does? What's your overall business model? So, there's also, so this is sort of the initial stage, right? What, on an ongoing monitoring, what happens if, if there's some type of, cure or immunization for this going forward?
That's a great question. I mean, there are many things that we're monitoring very closely. And that's one of the advantages you get when you work with us is we are, keeping up with all the guidelines that almost seem to change by the day in terms of testing, in terms of treatments. So a couple things that could develop that would be game changing. One is if these antibody tests, the serologic tests, the blood tests, right now you can get these tests, but we don't know what it means, right? If you test positive for the antibody, does that mean you're immune? We don't know. So more developments there could certainly impact the back to work program. You may have some people that turn out are immune and can just go back to work and can be treated differently. Certainly there's two kinds of treatment of medications that could come out. One is treatment for people who have COVID, and that would be something we could obviously use as part of our visits with patients and our treatment program for people who test positive. The other medication that could, become available is could there be a medication you would take prophylactically to prevent getting COVID if you're exposed? We call that, we call that prophylaxis, right, or pre-exposure prophylaxis. So in that setting, it seems unlikely that everyone in a workforce would take such a medication. It could be that those who are exposed would. Right. And that highlights the real importance of contact tracing. So it's really important part of what employers need to know as they bring people back to work is they need to keep their distance, they need to wear masks, but you also need a way of knowing who they're around, right? So segregating them in a way so that if if Jane at the end of the hall tests positive, who's Jane around? Hopefully not everyone in the building, but
Right.
the 10 people that Jane interacts with. And those are the people that we could then screen for symptoms. And if there were a medication to help prevent COVID, you could think about taking that. If there's a vaccine, hallelujah, we would all be so excited. I think we're still some months away from that. But were a vaccine to come out, a whole lot of things will need to happen in terms of the distribution channel for that and the production of those. But certainly FireFly and others can help make sure that people get the vaccine, and that, if there's not enough vaccine at first for everyone, who are the highest risk people who should get it first, right? It may be those folks who are older, a little sicker, have some condition that compromises their immune system. They might be the ones to get it first, and we can certainly help with that.
That's great. So thanks again, Jeff. And, as always, we'll make sure that we include Jeff's contact at the end of the video clip for everyone. And, so lastly, as we sort of sign off here, we've all worked so hard, during this quarantine, and, we don't really want to let, the gains that we've made go. So, please, continue to stay safe. Keep an eye out for other regular updates, sort of from us in this series. And thank you very much for your time.